and leader of the Association for Humane Drug Policy, FHN, and he will give us a bit of an update on the state of the debate around decriminalization in Norway and the efforts, the untiring efforts of his organization to promote drug policy reform and in particular decriminalization. So Arif, you've got the floor.
Thank you so much, Marie. And as Veronica said, we have a drug consumption room, and last week we got the heroin-assisted treatment in Norway. In February 21, a conservative government in Norway suggested a model for decriminalization. And I remember so clearly when I was talking about this at the side event here at CND last year, we were awaiting the opposition's response the very same day. And I said then that it was so exciting, it was a thriller. And even though the opposition did turn the suggestion down and later on form a government, it still is a thriller. Due to the findings of the Drug Reform Committee, the previous government's proposal and the debate that followed, changes have come in motion, both in attitudes and practices that we didn't even foresee. It all started by a majority of the representatives in Parliament making it clear in December 2017 that they wanted to transfer the reaction to drug use from justice to health. Civil society was the driving force behind this reform and was strongly included in the process. The slogan, "Support, don't punish," was finally embraced, but unfortunately with different understandings of the word support. The slogan for the Norwegian drug policy reform was "From punishment to help." And some understood this as decriminalization, and others understood this as a policy where punishment is replaced by treatment to stop using drug treatment. So what happened during the discourse was that drug users were divided into three constructed groups: young and experimental drug users, adult recreational users, and people with severe drug dependence. The majority of the parliament thought that they should replace punishment with treatment for persons with severe drug dependence. But they opposed decriminalization as such because they still thought that we should maintain the criminal responsibility for young experimental users and adult recreational users. The logic behind this thinking is that young people don't know what's for their own good, so they must be forced into a control-based follow-up with urine tests and conversations for up to a year to avoid punishment. And if drug use is again detected, punishment must again be considered. And they think that adult recreational users must bear the burden of punishment, because they should take the responsibility for the problems that the illegal trade makes. And they think that those with severe drug dependence should be considered as so sick that they are not liable, but to be put in a category with children and mentally disabled, and therefore they should not be punished. So the government's drug policy reform was turned down because of these, in my opinion, stigmatizing attitudes, this political abdication of responsibility, and this unfortunate construction of groups of drug users. Even though the parliament did make some changes. For instance, from now on, less serious drug offenses shall be deleted from the criminal record after 3 years, and the Good Samaritan law was implemented, which says that one shall not be in risk of being punished for drug use or possession when people call for help in situations where someone is in danger, like for instance in overdose situations, so that they will no longer hesitate to call for help. But after this, there has also happened a lot of other changes. Drug testing of students and pupils is finally settled as against the law, and therefore the practice is finally stopped. Also, an old tradition with police bringing their dogs to schools to find drug users among the pupils and to drag them out to arrest and to have them kicked out of school has finally come to an end. And finally now it sparks an outrage when people hear that those who express a wish for a more liberal or humane drug policy are being harassed by police and child welfare services and so on. There are several things that is happening that shows that the attitude in the society is slowly shifting in a way where the criminal response is transferred from people using drugs and over to those who are treating drug users bad. And one of the more exciting changes is that the police now are forced to change the way they treat drug users upon arrest. During a hearing at Parliament in March 21, the main opposition to reform, police organizations and police representatives warned that decriminalization would rob them from their tools to prevent drug use. What they meant about their prevention tools was to take urine samples, search cell phones, and search homes when suspected drug use, so that they could find who provided them the drugs. The Attorney General reacted strongly and then wrote a letter to the police explaining that they do not have the authority to use such privacy infringing measures if suspected drug use. And now this search practice is a subject of investigation. Also, Norway's Human Rights Institution has reacted on this practice, stating that it seems to be a violation of both Norwegian laws and the European Convention on Human Rights. In my view, one of the most interesting things that has happened is that the court system itself has started to reducing penalties in drug cases. In some cases, changing sentences from months in prisons to a few weeks suspended sentence. The reason behind this seems varied, but one of the main ones is that if all parties in parliament agree that people with drug dependence should not be punished but helped, how can the court system continue to punish? Within the court system, it has also been expressed that punishment for drug use is pointless. In 5 days from now, March 22nd, the Supreme Court will decide whether criminalizing people with drug dependence is a violation of the Constitution. And there's a great chance that they will come to the conclusion that it is. On one hand, some say that the parliament cannot have a policy without equality before the law. So therefore, we cannot decriminalize just for some. On the other hand, some say that we cannot criminalize people with drug addiction because the majority of the parliament is against it. And therefore, we cannot criminalize other groups of drug users either. And another important question that is raised is who is to decide whether a drug dependence is severe enough so that they won't be punished. In addition to all this, 5 political parties at the parliament have suggested a rematch for the drug policy reform. So the groundbreaking debate is still ongoing, and the municipal authorities in the capital, Oslo, are working to get permission to have a local pilot tryout for decriminalization. So this is where we are at the moment. When the big debate about decriminalization started, people's eyes were opened. Different parts of society began to evaluate itself. It gave birth to rethinking what had been considered as right and wrong for decades. So to conclude, the debate about decriminalization is not something to fear, but an opportunity for growth and human compassion. And believe me, the situation, it still is an ongoing thriller.
Thank you so much, Adil. And it's fascinating to see you guys continue your work in advocacy and see the debates moving forward so much and so fast in Norway. Fingers crossed for early April, and we'll be following you. Please let us know how it goes, and hopefully that will unblock the situation.